While preparing for pregnancy or while pregnant, it is important to live a healthy lifestyle, which sometimes requires lifestyle changes in order to give your baby the best chances at growing healthy and strong while in your womb. Part of being healthy during pregnancy is avoiding teratogens. The word teratogen is made up of two Greek words, the first being terato, which means monster, the second being gen, which means making. These two words put together form the phrase monster making. That sounds frightening, but by true definition, teratogens are any factor, chemical or physical, that adversely affects the fertilized ovum, embryo, or fetus. Teratogens are the cause of many birth defects and even miscarriage. Your baby is most vulnerable to teratogens and subsequent deformities during the first trimester of your pregnancy when their vital organs are being formed. However, there are still many teratogens that can negatively affect your baby throughout the whole pregnancy and even during birth. In this video, we will learn about common teratogens so that increased awareness can prevent exposures leading to healthier moms and babies. Some infections that are acquired by the mother before or during pregnancy can be teratogenic. Malaria, caused by a bite from an infected mosquito, can be passed to the fetus, which can cause miscarriage or premature delivery. Avoid traveling when pregnant to places with high rates of malaria infection, like Africa or South America. Toxoplasmosis can cause your baby to have blindness or brain damage. It is spread through uncooked meat or cat feces. Make sure your meat is fully cooked and avoid changing litter boxes or even garden soil, since neighborhood cats and strays commonly choose to defecate there. Rubella is a virus that, if contracted during pregnancy, can cause hearing problems, cognitive and motor challenges, cataracts, heart defects, cleft lip, and restrict their growth. You can't get immunized against rubella during pregnancy, so it is important to be vaccinated before becoming pregnant. Genital herpes is a sexually transmitted disease that can be passed to your baby. It can cause miscarriage or premature birth. If you have lesions around the time of delivery, you will need to have a C-section in order to help prevent spreading the virus to your baby, which can happen as they pass through the vaginal birth canal when lesions are present. Cytomegalovirus is a member of the herpes family. Many women can have it and not know it. Contracting this virus during pregnancy can cause your baby to have severe neurological challenges, eye damage, hearing impairment, or chronic liver disease. It is spread by sneezing and other droplets from infected people. It is important to wash your hands frequently and stay away from places with crowds of young children, as it is commonly passed amongst them. There are other viruses that can affect your baby's health and development. It is best to avoid illness by washing your hands frequently, avoiding those who are sick, and being fully vaccinated. However, live virus vaccines should be avoided during pregnancy, such as measles, mumps, rubella, human papillomavirus, and poliomyelitis. There are certain medications that should be avoided during pregnancy. The FDA has drugs categorized according to fetal risk. As shown in the chart, there are 5 categories. Category A, B, C, D, and X. A category drugs show no risk to the fetus if taken by the mother during pregnancy. The risk increases as you go down the chart towards Category X. Category X drugs can kill your baby or cause very serious defects. All illegal drugs should not be taken and pose serious health risks to mom and baby. Any herbs should be taken cautiously, and you should consult with your healthcare provider before taking them. Caffeine is a drug and should be avoided. High quantities of caffeine can cause the vessels in your placenta that give blood and nutrients to the baby to become narrow. This can cause low birth weights and other complications. Alcohol should not be consumed in any quantity during pregnancy. Alcohol can cause your baby to have fetal alcohol syndrome. This results in cognitive impairment, neurological damage, and can alter your baby's facial features. Common facial features of children inflicted with fetal alcohol syndrome are short palpebral fissures, a thin upper lip, and an upturned nose. Cigarette smoking can cause infertility and can increase risks of miscarriage and having a stillborn. Some teratogens are environmental. For example, Impure air and water can also be unhealthy for your baby and cause defects. Metal and chemical hazards should be avoided. Stay away from pesticides, weed killers, and car exhaust. Also avoid being around fresh paint. Mercury can be harmful and is found in certain types of fish like swordfish and tuna, so eat these only in small amounts. Radiation exposure can cause damage to DNA, which can lead to defects. Exposure to radiation is most concerning if it is in high quantities and if the exposure is around the beginning of the pregnancy when the baby's vital organs are still developing. Examples of things to avoid that have high radiation are X-rays and most other medical scans other than ultrasound. Studies are still being done, but long-term use of computers, microwaves, and cell phones have shown not to be harmful to mom and baby. Stress can also be teratogenic, but only if it is extreme and prolonged. Examples of events that could cause this significant stress are tragedies like a house fire, death of your partner or child, or living in a war zone. If there isn't anything tragic happening in your life, you need not worry about your stress causing your baby health problems. Those of you who are pregnant and facing tragedies that may cause stress great enough to impact the health of your baby should seek help. Hopefully this video has helped you learn about teratogenic agents and how to avoid them, leading to a healthier pregnancy and baby. Refer any questions you may have about teratogens to your healthcare provider. They will be able to provide more information that will be tailored to your specific needs and situation.